This oncology patient we've been working with, they just got seen by a specialist and they've been denied for 9 months by the plan. And this is a patient with stage 4 cancer. They're denied by 9 months by the plan has now set them back 2 years in symptom management. We overturned that, by the way, in a day. So just to give you a sense of how effective these appeals can be.
That's such a great example. So patients who go from 9 months of not being able to access care to having access within 24 hours. One of the things that's so exciting about the work that Works is doing is it's about time. So that thread comes through. That cancer patient loses 2 years of therapy, and in one day that's wiped out. Health equity a lot is about time. What we see is that there are populations who die anywhere from 2 to 7 years earlier based solely on race. Fewer than 10% of people coding AI come from BIPOC communities. So the very assumptions that got us here may take us to the next level, carrying the same level of inequities and even more.
I don't think this is a solved problem. And there are a lot of these like little kind of assumptive errors that creep into healthcare, which prohibit people from getting care, right? So if your assumption's wrong and your data set is biased, you're going to scale chaos, not execution.
When you come into one of our ERs and you complain about pain, are you getting medicated in the same way, regardless of your race? Historically, that the answer would be no across the industry. So there's some really interesting AI solutions around that, and some initial findings look like that AI may be better at identifying appropriate pain management than humans, and can do that without some of the bias.
If you think about these transformer models, you could use them in two directions. You can use them to explain complicated concepts simply, or take a simple explanation and add in facts and evidence that support it, which is really what we use the AI for. So it's really allowing these patients who otherwise would never, ever have access to what feels like a team of lawyers and team of experts, physician experts, to have all of that at their command, working for them.
I think if
One,
you look about the positive side of it, it's good to even have this conversation reflects that we're learning as an industry collectively, that we can't just go headlong.
I will add that it's incumbent upon anyone here building a product. You've got to get sophisticated and you have to ask questions.